Hi, my name is Jacqueline, and I'm the supervisor of the Client Service Department at Quikaid, and I would like to take this opportunity to talk to you about the Quikaid Client Portal. The portal was designed by Quikaid for our Quikaid clients. Every feature and functionality of the portal was designed with you in mind. The portal allows you to conveniently check on the status of your claim at any time. It also gives you the ability to update your doctor's appointments with the click of a button and so much more. All you need is your social security number and a 4-digit PIN number of your choice. Let me show you how easy it is to register if you haven't already and how easy it is to use. First, you will need to navigate to my.quikaid.com. To register for the first time, or if you need to reset your existing 4-digit PIN because you forgot it, click on the green Click Here to Register Now button. Here, you will need to type in your full social security number, your date of birth, and decide on a 4-digit PIN of your choice. If the claim is for your spouse or your child, you will need to enter their information instead. Please know that the 4-digit PIN number cannot be the applicant's birth year, the applicant's last 4 digits of their social security number, 4 consecutive numbers in ascending order, such as 1, 2, 3, 4, 4 consecutive numbers in descending order, such as 4, 3, 2, 1, or 4 repeating numbers, such as 1, 1, 1, 1. After entering the required information, click on the I'm Not a Robot box, and then hit Submit. You are now registered for the Quikaid Client Portal. To access the claim, click on the Back to Login screen button. Now that you have registered a 4-digit PIN, simply enter the social security number, the 4-digit PIN that you created, and check off the I'm Not a Robot box. Lastly, click on the Sign In button. Periodically, the portal will ask you to verify your contact information. It is extremely important that Quikaid be able to contact you at any point throughout the process. Be sure to confirm or update your information on each page. First, you will be asked to confirm or update your mailing address. This is the current mailing address we have on file, which means your mail will be sent here. If your mailing address has changed, click on the Update button and proceed to changing your address. If the mailing address we have on file is correct, click on the blue Verify Phone Information button so that you can now verify and/or update your phone numbers. Next, you will be asked to confirm or update your phone numbers. If anyone from Quikaid must contact you regarding your claim, these are the numbers that will be called. Be sure to have the best number or numbers where we can reach you directly listed here. From this page, you have the ability to add a new phone number, remove old numbers, authorize text consent to allow Quikaid to text you, and choose which number should be your primary should you have more than one number on file. After you update this information or confirm what we currently have on file is still correct, click on the blue Continue to Email Address Verification button so that you can now verify and/or update your email. Now you will be asked to confirm or update your email address. Email is a great alternative way to stay in touch. Be sure to have the best email address that you have access to listed here. From this page, you have the ability to add a new email address, remove old emails that you no longer have access to, or choose which email should be your primary should you have more than one email address on file. After you update this information or confirm what we have on file is still correct, click on the blue Continue to Emergency Contact Verification page so that you can now verify or update your emergency contacts. Lastly, you will be asked to confirm or update your emergency contact information. Emergency contacts are important to a claim in case Quikaid is unable to reach you directly at your own phone number because your phone goes out of service or it gets misplaced. Be sure to have the best emergency contact persons listed here. From this page, you will have the ability to add a new emergency contact. Should the information that we currently have on file be incorrect or out of date, simply click on the green Add New Emergency Contact button and enter in your contact's information. After you update this information or confirm that what we currently have on file is still correct, click on the blue Done Return to your portal main page button. After confirming and/or updating your contact information, you will be redirected to the main dashboard, unless you have not updated your attendance to a consultative exam that you've had in the past. If this comes up for you, simply update your attendance. So in this case, there was a consultative exam scheduled, and you simply need to check if you attended this appointment or if you did not. Make your selection and click on Submit. After updating your attendance to your consultative exam, you're now directed to the main dashboard page. Here you will find the status of your claim and other valuable information. Note that although the status will appear not to change very often, this is normal. Your claim is still on track. The disability process is not a quick one. Therefore, although the average wait time expected for a decision is about 5 to 6 months at the reconsideration phase, for example, this is just an average. Actual wait times experienced can be longer. Quikaid has no control over the wait time that you experience. This is all based on your local Social Security office, Disability Determination Services office, and/or the Office of Hearings Operations and their availability. At the top of this page, you may also notice a hearing preference box. Regardless of which phase your current claim is pending at, our office wants to know what your hearing preference would be should the claim reach the phase of the process that requires a hearing before an administrative law judge. Our recommendation is that you opt in for either a video or a telephonic hearing. They're scheduled much sooner, and you have the advantage of not needing to travel, oftentimes at great distance, to an in-person hearing. The hearing can be conducted in the comfort of your own home without the added burden or stress of travel. Truthfully speaking, in our many years of experience, we have determined that your chance of approval is the same even with a hearing that is conducted remotely. To have a phone hearing, you just need to have a good working telephone. It will be like a conference call. To have a video hearing, you'll just need a smart device such as a computer, a laptop, or smartphone with a working camera, audio, and microphone. If you select this method of appearance, you'll also need to confirm your best phone number where you can be reached at the day of the hearing in case you need to be contacted. You can also choose phone and video. Depending on which one is available first, will be scheduled. So again, we strongly recommend that you opt in for either a video or telephonic hearing, and it's so easy to select your preference on the portal. To update your preference, again, simply click on the drop-down menu and make your selection. Once you make your selection, click on the green Confirm button. After you make your hearing preference selection, the hearing preference box will go away. You may also see a banner with information about a consultative exam that you have scheduled in the future. To obtain the details of this exam, you will need to navigate into the consultative exams page of the Quikaid client portal. Next is the medical treatment page. Here you will add any medical appointments that you have attended or will attend for your disabling conditions. This list is used to request all of your medical records. Note that you should not include any treatment information that is more than 3 years old. The Social Security Administration wants to know how your conditions are affecting your ability to work at the present time. Should you be seeking medical treatment for all of your disabling conditions, no matter when you were initially diagnosed, your current records will speak on the severity of your conditions. To add a new appointment to a doctor's office or a hospital that is already on the list, simply click on the I have new treatment at this facility button next to the corresponding facility. Make sure you scroll all the way down to review all of the facilities that are listed. If you want to see the last appointment date we have on file for each facility, click on the words Show Me When. If you have been seen after this most recent date, make sure to add this new information by clicking on the Go Back button and then clicking on the blue I have new treatment at this facility button. You will then be directed to a new screen where you will be walked through the information needed from you. You will start with the When was your visit field. You will only need to include the date of your most recent appointment. Month and year is acceptable. Any appointment prior to this most recent date will be included when your records are requested. You can also include the frequency of your appointments here in such cases where you have weekly or monthly appointments. As an example, if your appointments are frequent, add the date as a range, such as December 2022 through January of 2023. There is no need to add every single appointment date. Next, move on to the What was the reason for the appointment field, and include a brief description of what your visit was for, such as mental health, primary care provider, medication refill, back surgery, etc. Lastly, you can include the doctor's name, if known, in the Who was the doctor field. If it is not known, simply leave it blank. After you add all of the information required, click on the green Next button. You will now be redirected to the medical treatment page once again. You'll be able to see the entry that you just made. If you happen to add this information to the wrong medical facility, simply click on the orange Remove button and your entry will be deleted. Make sure to go back and re-enter the information correctly. If you need to add a new doctor's office or a hospital that is not on this list, click on the blue I have received treatment from a facility not on this list button. You will then be directed to a new screen and walk through the information needed from you. Make sure to include all the information required, as this will ensure that your medical records are requested from the correct location. You will start with the facility name, their street address, suite or floor number, if one exists, and the zip code. Our system will auto-populate the city and state for you. After you add this information, click on the green Next button. As we saw earlier, you will then be asked to enter the date, reason for the visit, and the doctor's name, if known. Once you add all the information required, click on the green Next button. You will now be redirected to the medical treatment page once again, and you'll be able to see the entry that you just made. If you made an error and entered the appointment information incorrectly, click on the orange Remove button and your entry will be deleted. Again, make sure to go back and enter the information correctly. Next on the list is the phone numbers page. Here you can update the phone numbers where Quikaid will call you. The numbers you add here should be the numbers where we can reach you directly. Do not add your emergency contact numbers here. You can add a new phone number, delete old numbers, and update your texting consent. Texting is a great alternative way to stay in touch. If you are able to receive text messages on your phone, we encourage you to sign up. To add a new phone number, click on the green Add New button and enter your phone number. You will need to have that phone, a pen, and a piece of paper ready. After you hit Next, you will receive a call from our automated system with a 4-digit confirmation code. You will need to enter this code before the phone number is added to your account. Once you have your code, simply enter it. You can also consent to texting from this page, or you can do it from the main phone numbers page. After you add in your code, click on the green Confirm button. You will now be redirected to the phone numbers page. If you forgot to update your texting consent on the previous page, you still have the ability to update your preference from the main page. If you would like to consent to texting, simply click on the Allow button and confirm, and then you're registered for texting. It's that easy. Now, if you have more than one phone number listed on your account, you will have the option to select which number should be primary by clicking on the Make Primary button next to that number, and it will be updated. Next is the email addresses page. Much like the phone numbers page, you can update the email addresses on your claim. You can add or delete any email address that you no longer have access to. Like texting, email is a great alternative way to stay in touch. If you have access to an email account, we encourage you to add it. To add a new email address to your account, click on the blue Add New button and enter in your new email address. If you're adding a new email address, you will need to have immediate access to it, as you will be required to enter a code before the email address is added to your account. After you enter in your code, click on the green Confirm button. You'll be redirected to the email addresses page. If you have more than one email address listed on your account, you will have the option to select which email should be listed as a primary. To update this preference, click on the Make Primary button next to the email that you want to make primary, and it will be updated. Next is the Emergency Contacts page. Much like the phone numbers page, you can update the emergency contacts on your claim. An emergency contact should be a family member, spouse, or friend that you remain in close contact with. If Quikaid is unable to reach you at your personal phone number because your phone goes out of service or gets misplaced, we will need to reach out to your emergency contacts. Should the information we have on file be out of date or incorrect, simply click on the green Add New Emergency Contact button and enter in your contact's information. After you add in all of this information, it will be your decision as to whether or not you allow Quikaid permission to speak with your emergency contacts regarding the details of your claim. If you choose to give us permission, check off the Authorize Consent to Discuss Claim box. If you choose not to, leave this box blank. Then click on the Add button. You'll now be redirected to the Emergency Contacts main page. Next is the Mailing Address page. This is where Quikaid and the Social Security Administration will send any mail regarding your Social Security disability claim. This may not necessarily be your residential address, but this should be the best address where you can receive mail. To update your current address, click on the yellow Update button. Start with the street address, enter in the unit, apartment, or lot number if one is applicable, and the zip code. Our system will validate the address you enter with the USPS database, and we will populate the city and the state for you. If you're receiving your mail elsewhere other than your own home, such as a shelter, friend or relative's apartment, or rehab center, make sure to include that information in the Care Of field. Don't forget to add a unit, apartment, or lot number if one is needed. Otherwise, your mail will not be delivered. After you add all of the information required, click on the green Next button. You'll then be asked to confirm that the information that you entered is correct. If it is, click on the Save button. Now you have successfully updated your mailing address. Your claim with Quikaid has been updated, and our office has also sent a change of address to your local Social Security office, the state disability office, and or the Office of Hearings Operations on your behalf. Great job! Next is the consultative exams page. Here, you will find information on any exams that have been scheduled with the disability office doctors. The date, time, facility information, and whether or not you attended the appointment will be listed here. If you see that you have an appointment scheduled in the future, please make sure that you understand and know where you need to go and arrange your transportation as soon as possible if you're scheduled for an in-person appointment. If it's a telehealth exam, there's no need for travel. Your attendance to these appointments are crucial to your claim. The appointments are completely paid for by the disability office. All you have to do is attend. Failure to attend will result in a denial of your benefits. Therefore, it is very important that you not only attend, but arrive on time, preferably early. Next is the downloads page. Here you will find important documents available for download. Documents include, but are not limited to, an evidence of filing. This letter can be used as proof that you have a disability claim pending. A medical source statement. This is a document that should be filled out by a doctor that knows about your disabling conditions the best. A disability questionnaire. These are blank copies of questionnaires mailed throughout the process by the Disability Determination Services, and a copy of your signed contract with Quikaid. Again, all of these documents are available to you at any time for downloading. Last is the Get Help and FAQs page. Here you will find answers to the most frequently asked questions. If you are unable to find the answer to your question, or you have a document you need to upload and send to Quikaid because we requested it, scroll all the way down and find the blue Still Need Help, click here to contact us button. Keep in mind that unless Quikaid specifically requested that you send us a picture or a document, we likely do not need it. If you need to inform our office of any updated medical appointments, please do so by visiting the medical treatment page of the Quikaid client portal. You should not send pictures of any medical records. Your full medical file will be requested based on the information listed on the medical treatment page. Note that you will need to have an email address on file before you can send our office a message, as all of our responses will be through email. You'll be required to enter 10 or more words with your question, comment, or concern, and then attach the document that you want to include. After including your message and adding an attachment, click on the Send button. As soon as you update your treatment, contact information, or upload a document on the Quikaid client portal, these changes will be automatically reflected in your claim with Quikaid. One of our client service team specialists will review your entries, and you will receive a response via email if one is necessary. Now, all that is left to do is click on Logout when you're all done, and periodically check in on the status of your claim and/or add more appointments. On behalf of the entire Quikaid team, we appreciate your cooperation and thank you for using the Quikaid client portal.